One of our hearing professionals arrives at your house with all the latest portable diagnostic equipment at a time that is confirmed to you on the day. They wear ID badges confirming they work for the outside clinic.
Hello John, pleased to meet you.
Hello, good morning.
How are you today?
I'm fine, thank you.
Good to hear
It's
it.
been considered.
Okay John, before we go ahead, I'd just like to confirm some details with you,
Sure.
if I may.
Your hearing professional will confirm all of your details, including medical history and symptoms, before starting the examination.
Highworth.
Yeah.
The whole consultation will usually take around an hour. This will allow for a thorough examination and ensure that your hearing professional can explain each part and summarise their clinical findings.
Okay.
Mm-hmm.
And, I'm just going to shine this light into your ear
Yeah.
using this piece of equipment here. This is called an otoscope. It will just allow me to get a good view inside of your ear canal.
The first part of your hearing examination is a Tosca P, which checks the health of your ears inside and out and looks for any obstructions that may be affecting your hearing, such as wax.
So keep looking straight ahead for me.
Yeah, sure.
That's great, thank you.
This is the part of the examination that your hearing professional may offer you the option to be referred to your GP for further advice.
So I need to make sure that the ambient noise level in the room is below the set standard.
Yeah.
I can ask you to be as quiet as you can for me, please.
Yeah.
Okay, that looks pretty good to me. There we are. Okay, John, so what we'll do now is we'll test your hearing. And what I'm going to do is measure the quietest sound you can hear in each ear.
Yeah.
All I'd like you to do, please, is press that button for as long as you hear the sound, and then let go when the sound goes away.
Will do.
Using an audiometer, your hearing professional is able to obtain an accurate measurement of your hearing. The test will reveal the extent of your hearing loss and will help determine the most suitable hearing system for you. This part of the examination will take about 20 minutes.
Okay, John, so this is the result of the hearing test we just did.
Based on your hearing examination, your hearing professional will discuss their clinical findings with you.
Left again. Now you can see there's a similar pattern in each ear.
These clinical findings will help inform all of the advice your hearing professional will give you to help you choose the appropriate hearing solution for your loss. One of the solutions may be the use of a hearing device.
Deteriorate.
Mm-hmm.
Now these are the different types of hearing aids available. And they're split up into two main types. You've got the in-the-ear types and you've got the behind-the-ear types.
Yeah.
Now, with your permission, I'll put these in for you.
Yep.
And you can see how they feel. So this part goes just on top of your ear there.
Mm-hmm.
Your hearing professional will upload all of the results from your examination into the demonstration hearing aids so you can experience a representation of the sound.
Now this is the hearing aids turned on with the extra clarity you've been missing from the high frequencies.
Yeah.
Now how does that sound at the moment compared to what you're used to? For
Well,
example?
depreciable difference.
It is.
Yeah, it is noticeable.
Good. What the manufacturers have done here is they've drawn up this guide.
They will also go through the various benefits available based on your social requirements.
Of handling
Yeah.
the situations that are capable of allowing you to hear better.
Based on your chosen device, the hearing professional may be required to take an impression of your ear so that a bespoke hearing device can be manufactured for you. Your hearing professional will arrange for your hearing devices to be delivered and fitted in the comfort of your own home. This will ensure that the settings can be fine-tuned to suit your home environment.
I look forward to making you hear better again.
Okay.